Okay, today we will cover the general features of the heart, and of course we would talk about the right atrium in details. Now, as you can see in this diagram, the heart is slightly larger than one's loosely clenched fist. It is, as we used to say, the heart is the size of individual's hand. It is a double self-adjusting suction and pressure pump, and this is something to talk about it in the physiology rather than in anatomy. Of course, the one of the definitions that I do like when I talk about the heart is this one here. The heart is a pair of valved muscular pumps combined in a single organ. We are talking about two muscular valved muscular pumps within a what we call the heart. Uh, the general shape of the heart is a pyramid. However, this pyramid has fallen on one of its sides. In our case here, it is the diaphragmatic surface, and therefore, sometimes, although these information are very simple, however, sometimes students they are get challenged by understanding where is the apex, where is the base, and etc. In the next couple of slides, I will do my best to explain this to you. So the heart is a pyramid in shape. It has an apex, base. It has four surfaces, borders, right border, left border, inferior border, and we will talk about them in details. Now let's listen to this video. So let's talk about the external features of the heart, and let's talk about the surfaces, borders, and the apex, the base of the heart. Here we have the heart as if it is within the living subject lying on its back. So here would be the diaphragm, and therefore we have this surface, the anterior surface, or because it is behind the sternum and the ribs, we call it sternocostal surface, all this anterior surface. Also we have this surface here, or two surfaces that come in contact with the lungs. That's why we call them the left pulmonary surface and the right pulmonary surface. Let me demonstrate each one of them. This one the right, and this one is the left pulmonary surface. Now the heart rests on an inferior, or we call it the diaphragmatic surface. In your body while you're standing, the heart is sitting on the of course the diaphragm. So this surface has been named the diaphragmatic surface because of its relation to the diaphragm, and of course the inferior because it is inferior in the anatomical position. So four surfaces: sternocostal, anterior, two pulmonary surfaces, right and left, and eventually we have the inferior or diaphragmatic surface. So as it was explained to you in that video, we have seen the surfaces, the sternocostal, which is the anterior surface here, this one here. Of course, we also have the pulmonary surfaces, right and left. This is the right one, this is the left one on the other side. Of course, we have the diaphragmatic surface. We talked about it. We will talk about each one of these surfaces as we proceed. Now let's talk about the apex of the heart. Now let's talk about the apex of the heart. It is formed by the inferolateral part of the, of course, the left ventricle. This is the left ventricle, and the apex is made out of the inferolateral part of the, of course, the left ventricle. It is directed downward, forward, and to the left. Lies posterior to the left fifth intercostal space, usually 9 centimeters from the midline, or hand's breadth from the median plane. Now the apex of the heart is very important. This is another view for the apex of the heart, of course, here directed in the living subject as we mentioned. Okay, now why it is important to recognize the surface anatomy of the apex of the heart, and to appreciate its clinical, of course, significance. It is where the sounds of the closure of the mitral valve can be taken or can be listened to. This is the apex of the heart. Now the next slide here, we should talk about the base of the heart. The base of the heart is the posterior aspect of the heart, and it faces the, of course, the thoracic vertebrae, and it is mainly formed from or by the left atrium, with little contribution from the right atrium. The base of the heart faces the posteriorly toward the bodies of vertebrae from T6 till T9, and it is separated from them by the pericardium, of course, oblique pericardial sinus, esophagus, and aorta. We will also talk about this in this video. Now this is the heart in its anatomical position. This is the apex, and if this is the apex, where is the base? The base is there, here. We are looking at the posterior aspect of the heart, and this is for sure the base of the heart. It is the posterior aspect of the heart. When we put it in the anatomical position, this is anterior and this is posterior. It is formed mainly by the left atrium, with a lesser contribution, of course, from the right atrium. Now, what you really need to know about the base of the heart, that it faces posteriorly, as it is the heart in the body. Posterior to the base here runs, of course, it faces the bodies of the vertebrae from T6 to T9. Don't you ever forget that we are the whole pericardium and the heart within it are within the middle mediastinum. So definitely we are below the intervertebral discs between the T4 and T5. So the base of the heart, which is nothing but the left atrium mainly, facing the vertebrae from T6 till T9. Also, the pericardium separates the base of the heart from the oblique pericardial sinus, the esophagus, and of course the descending aorta. So those are the posterior relations to the heart and mainly to the base of the heart. Now let's proceed. The sternocostal surface or the anterior surface is formed mainly by the right atrium and the right ventricle. Some of you may ask why we need to know the contribution of each ventricle or chamber into the walls, because we do image these walls on X-ray at least, and if we see that some of the walls is getting thicker or broader, bigger, thicker, or enlarged, it means that this wall, we need to know this wall is made by which chamber, and this gives you an indication that the right chamber or the left chamber is diseased. Now in this video we will talk about the this is the anterior heart, its anatomical surface and other surfaces. Adults, during embryogenesis, the heart was lying in the body of the embryo in this way, right in the middle. So this is the that would have been the left chambers, the left ventricle and the left atrium behind it, and here we have the right ventricle and the right atrium behind it. Now before birth the heart rotates 45 degrees to the left, and this is the final position of the heart in your body. And now we need to understand what has happened. The sternocostal surface that we mentioned just minutes ago is mainly formed by the right ventricle and of course the little bit of the right atrium. So the rotation forced the left ventricle to hide to the left and posterior, and brought the right ventricle to become a bit anterior. So when we talk about the sternocostal surface, the sternocostal surface is made mainly by the right atrium and the right ventricles, the right atrium here and the right atrium. This is very important to understand that the rotation of the heart has changed the final positions of these chambers. The right one, the sternocostal surface is made not by the left but mainly by the right atrium and the right ventricles. Now let's talk about the diaphragmatic surface. You need to understand that this surface is the inferior surface, and the anatomical position has been named diaphragmatic just for because it rests on the diaphragm. Of course, in this video also we would explain everything about it. Now let's talk about the borders of the heart. This is the left border of the heart, and on the other side, of course, here is the right border of um, I would rather now let's talk about the borders of the heart. This is the left border of the heart, and on the other side, of course, here is the right border of the heart. This is the inferior border of the heart. So these borders are very important on X-ray. We shall first of all explain them here on the heart, and then we may talk about them on plain X-ray. The left border of the heart, here we are not talking about the heart itself. We are talking about the image that we get on an X-ray. So it's a bit different from that of the real border of the heart, which can be made only by left auricle and left ventricle. Here we add up other structures because we see the image of the heart on the it is because of the way we see the image of the heart on an X-ray. The left border is made of the arch of the aorta here, then the pulmonary artery. Of course, it goes downward to see the left ventricle. Sometimes we could add, of course, the contribution of the left ventricle, or left auricle. Now, on the other side, you would see, of course, the contribution of the right border by the superior vena cava here, the superior vena cava. Then, of course, this is the right atrium of the heart here, and the inferior vena cava, So this is the right border, superior vena cava, right atrium, and a little contribution of the inferior vena cava. So those are the right and left borders of the heart on an X-ray. Of course, there is also the inferior border, consists of the right ventricle and the apex by the left ventricle. So on an X-ray, most of the inferior border is made by the right ventricle, except this area, it is a contribution from the left ventricle, which this area we already talked about it. This is the apex of the heart. So for to understand an X-ray, an image of an X-ray, you need to understand the borders of the heart. The left one, arch of the aorta, pulmonary trunk, the left ventricle. The right one, superior vena cava, right atrium, and a little bit contribution of course, inferior vena cava. The inferior border mainly by the right ventricle, except small area by the, of course, the left ventricle. Now, this is a plain X-ray, anteroposterior plain X-ray, and you need to analyze it. You have to go through the, of course, the borders. This is the arch of the aorta, and this is what we call the knuckle of the aorta, aortic knuckle. This is the aorta, and there we go here. It is the pulmonary trunk, and this is the left ventricle. So if you got any enlargement in this area, in that area, on this area, you need to know this is due to the enlargement in the left ventricle here, in the pulmonary and its left branch here in the arch of the aorta. Of course, I will talk about the X-ray in details later on. On this side, as you can see, this side here, superior vena cava. Then we have here the right atrium. So the right atrium, nothing to say about the right ventricle, for example. So that's why you need to know the borders and their representation or explanation and which part contributes to their formation. This one, the inferior border, actually here is made by the right ventricle, except this area, the apex, it is by the left ventricle. So in these two slides, just we explain the borders of the heart. Now, one of the most important clinical or external features of the heart, the presence of sulci, coronary sulcus, anterior and posterior interventricular sulci. I think this video will be more than helpful for you. Just here. Now let's talk about the coronary sulcus. It encircles the heart, separating the ventricles and the atria externally, of course. This is the right part of the coronary sulcus. It goes downward, inferiorly. Then, as you can see, this is the of course, the right ventricle here, and this is the right atrium. The sulcus does separate them externally, then it goes down to the inferior surface. This is the diaphragmatic surface. Here, let's join it from the other side. This is the left part of the coronary sulcus. Goes downward where it meets the other one. So it is a circle that separates, of course, the ventricles. Here are the ventricles from the atria. Ventricles, atria. So this is the, or these are the parts of the coronary sulci. If we put them this way, that's why we name them coronary. They are like a crown around the heart, but their course is a bit to be carefully studied. It's not a horizontal circle. Look at the way they descend here and there. So what is inside the this, or the coronary sulcus? First of all, it's this, the right coronary artery. Then when we go backward here, it is the of course, in this part here, the coronary sinus, the venous drainage of the heart itself. It's very important to focus on this structure here. As you can see here, the coronary sinus, it is in the coronary sulcus. What else? If we go on the other side here, so we describe this part here. Now we're going to the other side. This is the coronary sulcus. Here we have the circumflex branch of the left coronary artery. So the coronary sulcus is occupied by the main coronary arteries. On the right one by the right coronary artery. On the left one, on the left side, it's not as you expecting the left coronary artery. It is rather its branches. Its branch, the left coronary branch of the left coronary, which is the circumflex artery. Why is that? Simply, we would talk about it. The left coronary artery is very short as a stem. It divides into the anterior interventricular artery or left descending artery, okay, and of course the circumflex branch. So the circumflex, the one that would carry on running in the coronary sulcus. To make things easier for you, the contents of the coronary sulcus are the right coronary artery, as we've seen it here, the left circumflex artery, and posteriorly here it is occupied by, of course, the coronary sinus. Now the anterior interventricular sulci. We have anterior, we have posterior one, and they also summarized to you in this video. Now the anterior interventricular sulcus, it is on the anterior or the sternocostal surface of the heart, contains the of course the anterior interventricular artery, accompanied here by, if we can see it, by of course the great cardiac vein, Two structures in the anterior sulcus or anterior interventricular sulcus of the heart. Now let's turn the heart and check on the posterior, or it is not posterior, it is the inferior or the diaphragmatic surface. This, as we call it, the posterior interventricular sulcus. It is on the diaphragmatic surface, not on the posterior surface. You have to understand this. What is inside it? Of course, the posterior interventricular artery. This is the artery, accompanied by the middle cardiac vein. So we have two sulci, anterior interventricular on the anterior surface, posterior it is on the diaphragmatic surface. Now what is inside the anterior? Of course the anterior interventricular artery, accompanied by the great cardiac vein. On the other side here, the posterior interventricular, we have the posterior interventricular artery runs in this area, as you can see here, accompanied by the middle cardiac vein. Finally, in this part of this lecture, the wall of the heart is made out of three layers. The thin one is the, of course, endocardium, and another thin one is the epicardium. Sandwiched between them is the myocardium, and this video, I think, would talk about it. The walls of the heart, as you can see, are made of outside. It is the, as we mentioned, it is the visceral part of the serous pericardium. Now it is being called the epicardium. Then here, as you can see clearly, the myocardium. This is the myocardium of the heart, and of course it is lined from inside by endothelium. On this side you can see the difference between the thickness of the left ventricle, the thickness of the myocardium, and the thickness of the right ventricle. So this is the right ventricle, how thin it is, and here it is the left ventricle. 3 times thicker the left ventricle than the right ventricle. The epicardium, the most superficial layer of the heart, of course, and the myocardium, as you can see it here, the myocardium, then lined by, of course, the endocardium. Three layers of the heart has been we already explored them. Finally, here let's talk about the fibrous skeleton of the heart. This is a complex framework of dense collagen forming four fibrous rings that surround the orifices of the valves, the right and left fibrous trigon, the membranous part of the interatrial interventricular septa. You need just to understand that the heart, it's not only endocardium, myocardium, and epicardium. Right in its structure there is an element of fibrous tissue. This fibrous tissue is very important for many reasons. We will talk about them, but mainly to give the framework for the valves, the rings of the valves. It's a valvular structure here, the heart. Also, in the separation of the ventricles and the atria, it contributes. I have summarized them for you here. The fibrous skeleton of the heart keeps the orifices of the atrioventricular and semilunar valves patent and prevents them from being overly distended by an increased volume of blood pumping through them. Provides attachment for the leaflets and cusps of the valves. Provides attachment for the myocardium, of course. Forms an electrical, this is very important, insulator by separating the muscles conducting impulses, which is the conducting system, magnetically conducted impulses of the